Thank you, everyone, for attending this session. On behalf of Irish Pakistani Professional Association, medical side, myself and Dr. Mukhtar is here online as well. We both welcome you. We thought about it that how can we facilitate NCHDs going into their interviews. It is a really, really challenging and daunting task. It is scary at times, So the way we are going to work is, my name is Mustafa. I'm a consultant in emergency medicine. I work in St. James's Hospital, and I've been through the training scheme. Adil is a very senior SPR in vascular surgery, and he's been through the training scheme. He has sat a BST interview, and he has sat a HST interview. Dr. Vakar, thank you very much, has very kindly agreed to give a feedback from the perspective of a person who takes the interviews on the other side of the table. Dr. Vakar has been my mentor, and he is a consultant in emergency medicine, and he interviews regularly on BST and HST interviews. So he will not be answering any questions directly related to interview in emergency medicine because he sits on that panel, so there will be a conflict of interest. He will just give you a generic idea of what does he expect when a candidate is sitting in front of you. So Sid there has asked us, Sidra Nawab has asked us how to start with go through your CV. Adil, do you want to give me just your perspective? That first question generally is go through your CV.
Generally, this is a very basic question. It's one of the very first questions that they'll ask. When I was working through these interviews, there's two ways that you can go through your CV. One is chronological. And the other way, if you think it is not appropriate yet, that you're too long from your medical college, and you don't want to go through all the chronological, break it down into your clinical, academic, and teaching into three categories, and make sure in your CV that you have 3 or 4 points that you need to highlight. If you don't tell the interview panel these 3 or 4 points, they won't know these points. That's your responsibility. If you've done a master's and you don't tell the interview panel that you've done a master's, then that's on you, not on the interview panel. Don't expect them to know this. They're not going to read through every single CV that comes through the door. So you have to make sure that you highlight at least 3 points, if not 4 or 5, whatever you have that are important. If you've done a master's, if you've done research, if you're a second author publication, first author publication, make sure you highlight those things. Pakistani trainees, some of them have come through Pakistan. They've worked a long time in Pakistan, and they think the gap's too big and we don't want to show that hum log itne arse se kaam kar rahe hain. You can use those things to your advantage, and you can say, I've worked for this many years as a clinical officer. Yeah, I have experience in a tertiary care hospital. You don't have to go exactly every year I did this, and this. You can make a quick summary of this and just point it out. But I think if you're worried that there's too much in your CV, break it into academic, clinical, and teaching, and highlight those points. If there's a short CV, go chronologically and make sure you have points in it. Don't make it too long. I also think at the end, if you summarize those 3 points or 4 points that you have to say, you can say in summary, this is the important points in my CV. I think that makes it memorable, and that shows the panel that you worked on this question.
Bakar sir, sir, when you are sitting across the table and you ask this question, go through your CV, what are you expecting from the other side of the table? What do you want to know? My CV is 7 pages long, so you don't want to listen about the 7 pages.
No, definitely. I think this is, interviews are very predictable as well. You know what they're going to ask you. And then if you're well prepared for it, you have thought about it before the interview process, and you've sat at home or thought, like, what are the questions they're going to ask me? And what are my answers going to be? What are the strengths in my CV, which I need to highlight? That there are some weaknesses in the CV. I wouldn't call it weaknesses. It's something which you can improve upon. So always give it a positive spin. Like, they will ask you, what are your weaknesses? They'll ask you, what are your, things you want to do? And say, look, I just want to do this job so that I can get more experience. So CV is very That's the first question they're going to ask you. And what you need to do is you need to have well thought about it in your mind. The answer should be very sleek. So practice at home and say, look, this is going to be a 10 minutes or 15 minutes interview. They're going to ask me about CV. Am I going to spend the first 2 minutes or 4 minutes or 5 minutes talking about CV and the things you're going to highlight? So what is the requirement of the job? Have that in mind as well. If you're going for an SHO post, that's a different kind of CV which you're going to present. But if you're going for a registrar post, then that's a different level of experience and expectation I have across the table. But then at the same time, if it's a training post, like say, for example, it's a core training interview, basic surgical training or basic medical training interviews, or if you're going into the higher specialty training, then I would expect a different kind of approach with your CV. So I want to know, first of all, your answer should be very sleek. You should have well thought about it. You shouldn't be pausing in the middle, thinking about in the middle. And what I want you to do is, you may have a medical background, but in general, I want to know what is your relevant clinical experience in the specialty that you are taking the interview in. So yes, you may have a medical background and surgical background, but you're applying for emergency medicine. So tell me your experience in Pakistan. What are the good things? In Pakistan, we have wonderful experience, so highlight those things which you have learned back home. But then the more important thing is, I want to know about your clinical experience, which you have in Ireland, working to different departments. So highlight those and say, what was your role, what you learned about it. And the other thing is, clinical skills obtained, competency. So if you're an SHO, I don't want you to, say in emergency medicine, I give you an example. If you're an SHO, I wouldn't expect you to be intubating patients. But what I would know is that, yes, I've done my airway kind of skills workshops, and I know how to manage an airway, and I know my competencies. So there are some core competencies, yes, which I know, but if I know how to manage an airway, and if I need help, yes, I will get my senior, I'll get my anesthetic. So that kind of, that we're looking at your personality to see, look, you may be just an intern coming out of a job, and you may not have that experience, but is this person suitable for the specialty? So 3 things we are looking at. Number 1 is, what is kind of a personality of this person? Is it this person suitable for the specialty we're interviewing you? You may not have much experience, but what I would expect that, yes, if you get the job within 2 years, 3 years as an SHO, or within 4 or 5 years as a registrar, you're going to progress in the career. You're going to be a kind of an asset to the specialty. And if I give you an opportunity, you will be kind of proved to be quite useful for our department on specialty as such. So these are the things which I'm looking at. If highlighted quickly, as Dr. Adil has said, you may have few things which you need to know. Even in the higher specialty training, one person had done masters in research and publications. Mm-hmm. Now, these are the things which would be very unique. If you have done research, if you have done publications, if you are a kind of instructor on a course, say those things, because if you don't say it, we'll never know about it. So highlight all those things. Yes, I've done my relevant courses, ACLS, ATLS. I've done my exams. You should be very clear about exams, because this is something which you can't, put aside. Say, look, I'm doing specialty emergency medicine. I'm doing surgery, but I know basic surgical training. I've done my first part of MRCS. So I've done my first part of, general practice. So say all those things, which makes your CV.
Going back, Dr. Okkar, just to highlight, sometimes Pakistani interns and SHOs have asked me from Pakistan that they have a lot of experience, especially in surgery. They've done lots of surgeries. But when you're applying at an SHO level, I think the more important thing that the consultant or the hospital needs to be aware of is that you're safe. Not that you can do a million different procedures. It's more that you know how to manage a patient and you'll do it safely. I don't think you need to go and highlight, I can definitely do an appendix with my eyes closed. Doesn't make a difference. What you need to be able to say is that I will do all the steps that are relevant to this patient. I will manage, resuscitate, inform the seniors. Yes, I'm happy to do an appendix under supervision, and I will be more than happy, but it has to be highlighted that you're safe, not that you can just do everything. In Pakistan, I know we get a lot of free hands and we can do lots of procedures, but it is very important to be safe, and you do have to show that.
And that's kind of attitude sometimes goes against you. If my SHO comes to me and tells me, I'm going to go and insert the central line, and I've done it many times before, and you're first year SHO, I'd be really uncomfortable having you on my team, because I don't know that you have the confidence, but I don't know your competencies. So I would be less inclined to hire you if you brag about things that you shouldn't be bragging about, even though you might be very competent in it. So keep that to a low. The next thing that comes up quite frequently in interviews is conflict resolution. You are given a conflict that for GP practices that your patient is not, listening to you, or some sort of conflict. It's always a conflict. Every specialty has a conflict. Adil, any tips when there's a conflict scenario there?
Generally, when there's a conflict scenario, there's an acronym that we use. It's very commonly used in interviews. When the courses I took, they taught me this. It's called SPIES. So the commonest scenario that we were given at a BST level interview was, if your registrar comes in intoxicated or drunk, what would you do? The answer to the question, first off, is that you say that I'll ask my registrar in a non-confrontational manner to go and sit in a quiet room. I might need to give, a nurse might need to sit with him. The next most important thing is to get information, but also the most important thing you have to mention, I will go check all the patients the registrar has seen and make sure that patient safety is at the utmost concern. That you make sure that no notes were written that are not supposed to be, that no orders were given that shouldn't be. That is by far the most important thing. Next in SPIES is your initiative. You get all the information you can gather about, has this happened before? Has the registrar come in intoxicated before? Has this been an issue? Is there some personal issues? The next is, at an SHO level, you should escalate this. To escalate to who? You escalate to your consultant. In your HST interview or your SPR interview, you may have to escalate further, but that's at an SHO level, you escalate to your consultant. You explain what had happened. And then the last thing to do is support. Support is basically where you can be very honest and say, as an SHO, I can't fill the registrar's role, but I'm happy to offer my support where I can. I don't think you should lie and say, oh, I'll step up and be a registrar. That doesn't make you sound good. You're an SHO, you're applying for an SHO job or a BST job. You say, look, I'll offer my support where I can, and I'll fill in whatever roles I'm able to do at my level. And that SPIES is the acronym that you use: seek information, patient safety, initiative, escalate, and support. And that's very, very simple, but it's quick to use. You can use this for a intoxicated colleague. You can use this for bullying. You can use this for any clinical scenario along those lines, any professional scenario where you want to use. If you keep that in the back of your mind, you can make a format and answer the question.
The next question that we have there is, tell us about a mistake that you have done recently. How would you approach that?
Okay, so I think the most important thing, we all make mistakes. And I'll give you an example. Even at a consultant level, I was having my appraisal with the General Medical Council. So I worked in England and Northern Ireland for a year and a half before I came in here, and a yearly appraisal. And they asked me, so the person who was my kind of appraisal officer, he was a psychiatrist. So he asked me any kind of untoward incident or serious incident that happened. And I looked at it and I said, I don't think so. So his answer was, I think you must be lying. Or I'm surprised. It does happen. We all make mistakes. But what happens, the most important thing is the disclosure. And that's what happens. So if you have made any mistake, it's a clinical error or it's kind of a GDPR, you have put wrong stickers on a patient notes, or you have put a wrong kind of, make any of those kind of paper error or a clinical error, first disclose it to the patient, make sure that the patient is safe. So as Dr. Adil was saying, in any kind of this scenario, patient safety is the center in everywhere, central to all our dealings. The next thing what we do is we make sure that, okay, that person is off that shift. Let's make sure the specialty, the services are running. And third, how to provide support. So in this case, yes, make a disclosure, tell the patient what has happened, and then make an incident form, which we all do, and then inform you should all be kind of, other than the clinical indemnity, which all the public hospital provide, what I would advise everybody to have some kind of, MPS, personal kind of, indemnity. And that will help you with cases which are, say, for example, you go to the medical council or you make an error, the hospital can take up responsibility for the clinical error, but other ethical error, or if you have to present towards the ethics committee of the medical council, you should have some kind of a professional indemnity that you have taken. So disclosure, tell the patient what has happened, try to correct it, see what you can do, tell your colleagues, do an incident form, and then what you do is go back and say how you can do a remedial for it. Attend a course about it, whether it's a clinical course, and just make sure that that mistake is not repeated. So I think acknowledging its disclosure is very important. I think the problems arise later on when people.
Thank you, Dr. Waqar. That was a brilliant short through of this whole how to approach your weakness, a mistake. So the next question that we have is, how do you handle stress at work, and what is your weakness? Adil, this is a common scenario that tell us a weakness.
Unfortunately, this question comes a lot, and a lot of people struggle with this. The commonest answer I've heard my SHOs, my interns, everyone give, sorry, that my weakness is I seek perfection. Everyone says this to me whenever I'm practicing with them. Try not to use that. It doesn't sound right. If you do have a weakness, the only advice that was given to me in interview courses was it should be a weakness that is correctable and that you're working on. A very good weakness I've heard was that someone said, I am weak at public speaking, so I've taken it upon myself to present at meetings and grand rounds so that I can improve. And I am generally getting better at this, and I will continue to do this. Someone said, my weakness is that I am too caring because I am always around my patients. That makes no sense. It doesn't show that that just shows you're empathetic. It doesn't really show that you're good at your job. I think a weakness should be something that you are already correcting or in the process of correcting. You shouldn't say anything that makes you sound unsafe. I think that is important as well. You say, I have no weaknesses. That's not true. You can't say that. You should have something. Everyone has something that they're correcting and working on. And I think it's just to think of an example that works for you. And if it's true, that is the best thing, because then you can easily talk about it and highlight it. I would never, ever recommend in an interview to lie. I think you'll always get caught out and it'll always look bad. You have to think about this answer for yourself, what works for you and what you're correcting, and then just say that as your weakness.
Are you competent enough for this post? Yes, I am very competent for this post. And that is why I'm sitting in this interview to prove to you that I'm very competent for this post. Never, ever say that I'm not competent or I'm trying to be competent or I'm working on it. Go with an attitude when you're going for an interview. And this is what Dr. Waqar said to me 7 years ago when I was going for my SPR interview, that go with an attitude that you are there for the job and you are the best. And there's no one better than you in that table, irrespective of what you think and what other people have told you. And even if you know all the candidates, that sort of attitude, that sort of behavior that comes the way you speak, that comes the way you approach the person across the table. So you are certainly competent for the job. That is why you are in that interview. So yes, I'm competent. And why are you competent? Keep a record of that. I'm competent because I've worked for 2 years or 1 year or whatever time in this, and I've done this skills course, and I've done my ACLS, ATLS, and APLS, or I've done my obs and gynae course or something that is related to that job. Have a generic answer that you are definitely competent for it. Examples of stress situations that you encountered recently, definitely have a good answer. Generally, a conflict works very well. Dr. Waqar, what do you think about if someone asks you that examples of a stress situation that you have recently encountered?
I think you have to be honest. Like, we are all humans. And especially we all had a very tough time working through the COVID situation. But as I was saying, like, you're not going to, and I'm probably slightly taking a different approach, but Dr. Aziz says, and fine, we're not going to lie about it. Definitely not, because it takes you nowhere, and you have to be honest in whatever you say. But even in your weaknesses, or even kind of a stress situation, give it kind of a positive spin. And that's what we are looking at, that this person is going to be part of a specialty, emergency medicine, vascular surgery, cardiothoracic surgery, whose normal day works from 8 a.m. to 8 p.m. So we are going to be, our personal lives, yes, we have stress, and this is kind of a reality. So yes, we do come across stress situation, and you should be, and at times because of our personal illness or stress at work. Burnout is a very common phenomenon, so be aware of it. Mention it. Yes, on occasions, I have been stressed out because of workload, family load. And what I've done back is I've just stepped back and say, look, the most important thing for me is, yes, my health, my family life, and then also my work. And that's very important as well. We can't ignore it because patients depend upon us. So what I would say is, if I'm in a situation of stress, I've gone through a bit of stress, I know what are the resources available for me in the hospital and the HSC, and I can approach those resources. I can step back a little bit. I can change a few things in my lifestyle at work. But then I know that at the end of the day, I have to come out of that situation. I can't let it take over myself, and I have to either go to gym, do exercises, take some kind of, go on a holiday. And these are the things which put me back again on the track. So say it in a way, you're a human. We are all stressed out. If you say, I never get stressed out, I enjoy working all the time, probably you do burn out. It's a phenomenon. It's a very common phenomenon in emergency medicine. But say, look, I tend not to affect me. I step back. I set my priorities. I make sure that at my job, I'm working properly to my full capacity. My patients are safe. I need a bit of time off. I go on holidays. I join a gym. I exercise. I know all the resources available in the occupational health in the HSC. I approach them. And I think you take that kind of approach, a positive approach, that yes, we are vulnerable, but I know how to deal with it.
Just in this, Mustafa, to highlight, there is an acronym that was used. If you're describing a scenario, any scenario, you can use an acronym called STAR. Like Dr. Waqar did, he described a situation where he was stressed. He described the tasks that he had to do to take a step back, to assess. He took these actions and he gave the result that he's better off now. So that's STAR, STAR. So you describe the situation, you describe the tasks that need to be highlighted, you take the action, and then you describe the results. And that way your answer can be in a good format for you to describe the situation.
For all the questions and answers, couple each of your answer with a personal experience, so that it doesn't look like that you're reading out from a book, that I had a bad day and the patient's attendants were not happy with me and they shouted at me for first, and I had a really bad day. So before going home, I spoke to my registrar that how does he manage the situation, and gave me his idea of how to manage that situation. And then when I went home, I watched a movie to de-stress, and I, have a generic answer, but couple your answers to your personal experiences. And that is the most important thing. Otherwise, it is going to look like that you are reading from a textbook, and this is all something completely random. So whatever your answer is, couple it with a personal experience, ideally. What are the low points of your career so far? That's a question. And what are people looking for? Open to the crowd. Waqar, Sabar, Adil, anyone?
I think we all have ups and downs. So yes, the low point in my career was, coming to Ireland, away from home, homesick at the time, coming to a different country. So these were all the personal things that I was kind of struggling with initially. And then I thought that, yes, I took on the surgical training program. I liked it. But then I wasn't totally happy because as an SHO level, I was not getting much exposure. And then I thought I'll become a registrar. What's the way out? And then as part of my rotation in surgery, I went through emergency medicine and which I had no experience before, no exposure before, and I loved it. So it was kind of a way out for me, but it's not because I didn't like surgery. I thought I liked emergency medicine more than surgery. And when I joined it, and the rotation that I went through, I thought I love it. And that gave me kind of a hope, but that gave me a kind of very enthusiasm. And I started working more hard, and I thought what I should do to become a reg, then what I should do to get onto the training scheme. So that kind of gave me a very good feeling, personal feeling, to work hard, to strive for something, to plan for something, and then to achieve it. So yes, at times you would feel like, is the door stopped ahead of you? And that's what you need to do. And that's a kind of a question which actually was asked in my SBR interview, like, how did you choose emergency medicine? And you have to be honest and saying, look, I've done my fellowship and I've done my surgical. Why did I choose emergency medicine? And that was the answer, which I gave my interview. That is kind of an answer, I would say, from some of the interviews I had last time. And some of the registrars say, oh God, I was so experienced. I worked in this special surgery for such a long time. I didn't get the job, and look, an intern got it. It's more like, what are you going to achieve in the next 5 years? And I probably would give a job to an intern who I think will achieve a lot, do good for himself, herself, or for the specialty, and move forward and in their career progression, than somebody who has been static for 3, 4, 5 years and don't know what to do. So we all have these low lives. We hit a wall, but then the important thing is what you like the most, what you want to do, strive for it, plan for it. And it's kind of be clever about it, how I'm going to achieve my targets. That's important.
So what Waqar did here, that again, he followed exactly the STARS scenario that Adil described there. So a situation, then turned it around into his personal experience, coupled it with it, that what was his low point in the career, and how did he couple with it, and how did he turn it out into positive way. And that is important as well, that how do you channel it through? If someone is stuck in a low point and they don't want to swim out of it, he's not going to be a very productive candidate coming up. But when what was your low point and how you channeled it through, and how did you turn it for a positive for yourself? That sort of answer they're looking for. There's another interview, that what matters to get shortlisted for SHO interview. Talha, I understand that you're from Pakistan and you're an IMG. So tell a few things. This is not basically targeted on SHO interviews of people trying to get jobs in Ireland, but I'll just give you a good few things. So jobs, when you're applying for, make sure that your CV is suited to that job. You've done pediatrics for the rest of your life and you're applying for a psychiatry job, you'll not get it. 2, structure your CV properly. There shouldn't be any grammar. When I look through a lot of CVs from Pakistan, I see grammatical mistakes. I see a huge picture of yourself with very little information about yourself. So, put more information. The way when I'm looking at CVs shortlist, it starts from your primary education, secondary education, tertiary education. I'm not really interested. I'm interested in, why do you want to come to me right now? What have you done in emergency medicine or surgery? Or to structure your CV accordingly. And then when you do get the interview, again, go through someone to talk you through what are interviews. Generally, there are triage scenarios, SHO levels. Jobs we are not expecting, as Waqar mentioned earlier. I'm not expecting that you should be a master of appendectomies, or you should know how to insert chest drains or do a tracheostomy. You should be a safe physician. That's what we are looking for. How do you handle pressure at work? That is another question.
Again, like everyone's been saying, use a personal example for this. Use the STARS acronym. Say, look, I was under pressure at work. In COVID, a lot of the staff were sick, unwell. There was extra workload, and we were struggling with this. So there was theaters running, clinics running, and use a personal example that I had to be in theater and clinic. I can't be in 2 places at one place. So I took a step back. I looked at what staff was available to me. I allocated jobs that the SHO could do to the SHO to go and see a few of the first patients in clinic, to keep them there till I return. I went when the consultant was in theater, told them that we do need to cover clinic as well, assisted initially, and then went to clinic when it was safe to go so. And then after doing this and having it well organized, we got good results. We got through the day, but we've learned that with short staff now that we reduce our clinical workload. It's a personal example. It's happened to everyone in COVID. Everyone's had to readjust. Use a personal example, use the STARS model, structure your answer that way. It makes it sound more professional and it seems like you actually know what you're talking about.
Share some tips for upcoming GP interviews. Thank you, Anza, for asking that question. So essentially, whatever specialty you're looking for, whether it's medical, surgical, psych, emergency medicine, you should know what is hot and happening. Okay. For example, for GP interviews, you should know that GP contracts is a big issue. GP recruitment is a big issue. If you go through the video that Brian King did, he mentioned a lot of issues that GPs are struggling with at the minute. Go through them. And again, approach to the interview. The interview questions are generally generic. Irrespective of what the specialty you are, there will be one clinical scenario that would be related to your specialty. Otherwise, these interviews are focused on, particularly GP interviews are focused on an intern level. So as I mentioned earlier, I spoke to one of the GP trainers because that question was asked earlier, that what sort of competency are you expecting from people who are coming for interviews? So the GP trainer said to me that, listen, a lot of our people go from internship straight into a GP scheme. Okay, so for a GP scheme, they are not expecting you to be clinically proficient, but they want to know that you are a safe physician, that if something happens at your practice, if someone comes in, if there are 10 patients in your practice, one is having chest pain, the other is there for repeat prescription, the other one is an IV drug user looking for his, telling you that he lost his prescription diazepam. How are you going to triage that? And what are you going to do? So keep that in mind, be patient-centric, make sure that you're a safe physician, and approach your interview in a way that you are here to get the job, not in a way that you are here for not to be selected, or you're here worried about that you're not going to get the job because of whatever reason mentioned to you. So have that positive attitude when you're approaching that interview table. These are just a few tips specific to GP interviews. That have a look at, go to ICGP website. They've got brilliant videos about what they expect from a GP. Brian's video again is very relevant to the issues that GPs are structuring with his own personal experience from his interview. So couple that with these generic questions and have a positive attitude going into it. Bakar Sahab, any other questions that you think people struggle with?
I think, and you kind of asked me initially, what am I looking for? If you look at all the interviews, I can divide them into three kind of interviews. As I said, one is kind of standalone jobs. You're looking at SHO or registrar. The other are the training posts, where you're looking at the core training and the higher specialty training. And I've gone through these interviews on panel on these interviews. So the core things they're looking for is, number one, your CV. As I said, you should have this at the tip of your fingers, and you should try to tell them about all the good things about yourself. The other thing which is always there in a CV, always there in these kind of station, and especially the training posts, which we are suitability for the specialty. So they are trying to judge what is your general personal attributes and your personality that makes you suitable for that specialty. So they will always ask you, why did you choose emergency medicine? So we have kind of, standalone jobs, as you said, somebody who's done all pediatrics and suddenly they applied for emergency medicine, and you ask them, why did you choose emergency medicine, or why you're choosing surgery, or why you're choosing a GP scheme, or you're doing surgery. The other question, why do you like in, say, emergency medicine or department? The other question they'll ask you, what are the good things in GP scheme? What are the things you don't like? And you should be honest, some of the things you don't like, but then it means it's make it like a challenge. You don't say, oh, I don't like working in emergency medicine because of the shift work, unsociable hours. I don't like to work in cardiothoracic surgery because my normal working day is 8 to 8, or, vascular surgery in the middle of the night. You just get a bleep and suddenly you have a AAA and you're up in theater all the time. What are the top 5 qualities of a good doctor? They're going to ask you. These are the very common questions that comes in the training posts. interview. What are your strengths? What are your weaknesses? Give it a spin, as I said. We all have weaknesses, but as Dr. Adil said it very nicely, like, his answer was best of all I heard so far. What are your weaknesses? Say, look, I want to improve my, spoken and, those kind of things, like how I give a presentations. But about the training scheme, very, very important. You are applying for an emergency medicine. You're applying for a GP training post. You should know very well what are the training scheme comprises of. What rotations do you get? What are the exam format? Like in emergency medicine, people ask them, they go for interview in the training post and they don't know what's a core STEM training, what exams do you have to do. Then you have to sit the ASAT exams for the A-STEM. Then you have to do 4 years of SPR training. Then you have to do the, FR Chem. So you should know about this. And it just shows like how much serious you are, how much effort did you took to know what you're going through, rather than have no idea of what this am I going into and say, I love emergency medicine. Do you know anything about emergency medicine? No, I don't know anything. They're looking at your good team player. There are certain specialties where you have to have your leadership skills, and every consultant, every senior SPR, you have to have a leadership kind of qualities. We are now going into kind of the SPR interview area. Being a consultant in any specialty is not just the clinical thing. Oh, I am a consultant because I want to do all the AAAs and I love that. No, you're a consultant because you are a good part of your job is you're going to be a teacher. You are managing rota. You have done a quality improvement projects. You're making and supervising pathways, guidelines, organizing the departments, improving specialty. So these are all things which they look for when you are going on into the SPR interview. Another very important thing is they're going to give you a clinical scenario. It's going to be part of every interview. It's very common we give to standalone jobs at an SHO level. I expect certain competencies at an SHO level, and then slightly different in a registrar level. But then in a training posts, I've gone through both the A-STEM and the C-STEM. So I've gone to a few of the clinical scenario during the interview. So that's also a very kind of, a core component of your interview. So be prepared for it. And it's very simple. We can talk about this in a while in a second question if you want to go towards the clinical scenario parts of it. But that's it. Anything else you want to add to it, Dr. Mustafa or Dr. Adil? But that's what I'm looking for.
Adil, any other questions that you generally find trainees coming to you that they're struggling with?
No, like Dr. Waqar said, generally those are the questions that you get in most interviews. And I do think suitability is a big thing. So you do have to present yourself as if you want this job. You know what you're talking about. You've researched this job and you know what you're going to do. Other questions, sometimes they do ask about breaking bad news. That's more at an SPR and registrar level than I think at an SHO level. But we can discuss that in detail if that comes up. But there's an acronym for that as well, called SPIKES. But you can Google that and also find it. It's the same: situation, perception, initiation, knowledge, and then leaving them with a plan. The other things that people do commonly ask is, people generally, I've seen when interns and SHOs practice for the thing, the very first common thing they do is that they leave out their own strengths in an interview. They treat it like an exam, like a viva, or like if they're asked a question, a very simple question. In my SPR, I got asked I applied for the SPR twice. First interview, didn't get it. Second interview, I did a lot of courses and got it. First interview, I got asked a question, what is research? My very standard answer was research is used to initiate and make medicine better and improve ourselves. And I stopped at that. I thought that was the answer. That was good enough. But after the courses, I learned, no, that's not the point of that answer. All the consultants behind the desk know what research is. They have their own opinion on it. That's not what they're looking for. What you need to say is that research is a method to advance medicine. And I am currently involved in this much research. I have done this. I have published this. And tell them about yourself. That question is an opportunity for you to bring in your research experience and let them know about it. At a registrar level, yes, you should have achieved some research and you should be able to say that. At an SHO level, if you haven't done any research, that's okay, but you should be able to say, I'm involved in something. I am doing this project with them and know about the project. If you recently just started an audit, say that. You can say, I've started in a new department. We are doing this audit. I am currently in the first phase of collecting the data. Then at least they understand that you know what an audit is, you know what the cycles are, or you know what research is, and they have an understanding that you're doing something along those lines. So yes, although there are some questions that are structured like a Viva, what is research, what is audit, but they're not meant to be answered that way. You do have to bring something about yourself in those questions. You have the opportunity, you should take it at that step and do that.
And just to add on to that, if you are writing that you've done an audit, you should know that audit inside out. If you're writing that you were the second author in a paper, you should know that paper inside out, because that is going to come up that, oh yeah, you've mentioned in your CV that you've done 2 audits. Can you tell us about the second cycle? And a lot of the people would struggle with, oh, second cycle, well, yeah, but that's, so know your audits, know your questions, know your whatever research you have done, you should know it inside out. You should know the results. So I did this audit. This was the result of phase 1. Then we implemented upon this, and then I made this change, and this is how I improved, and this was the result of the second cycle. So know your things. As I said, knowing your CV is the most important thing. You should know your CV inside out. Don't write anything on your CV that you're not sure about, because that can come up and you will struggle and you will fail. You will falter and you will fall off if there's anything that you have put in there that are not directly related, that you don't know about. Okay. Any resources on, there's a question, what courses did you do for interview prep? There are various agencies that would take you through interview prep. They'll give you a structured scenario how to do it. There is, I don't remember the names on top of my head, but there are 3 or 4 agencies who are in Ireland who specifically focus on doctors' interviews. Adil, do you remember the names?
There's one in Dublin called Cars Communication.
Yeah, I did that as well.
Cars Communication. There is a Communique International as well. There is a Career Jungle as well. There are 3 or 4 different agencies, and they can structure you. The more money you pay, the more they do for you. Okay, that's very simple. They can structure your CV. They can write your CV for you. Structure it in a proper manner to make it look better. You pay them more, they'll do 1 interview session. You pay them more, they'll do 3 interview sessions. You pay them more, they'll tell you about your body language, your gestures, your eye contact, how to approach the camera, how to approach a Zoom interview, where to look at when you're doing a Zoom interview, how to ensure that you have got an eye contact when you're doing the Zoom interviews. So just to name, there's Car Communications, there is Communique International, and there is Career Jungle. And none of us have any financial ties to these any of them. We've all been to various of these. You can pick and choose whichever you want, but they do need advance notice. They wouldn't be available at the last minute most of the time. They're fairly busy because they're doing various kind of interviews. Michaela, you've asked us, what is your approach to ethical questions? Can you be a little more specific? What sort of ethical questions are you looking for? Resources for emergency medicine training interview. Remember, be patient-centric. There will be a conflict. Again, you have to be patient-centric. Very important. Same as what we have mentioned. If you're looking at Irish interviews, go to IAEM's website. Go through what are the latest, what is happening in IAEM. You should know about how COVID has impacted emergency medicine, and what is your solution to bed crisis. You should have a generic answer to that. There are no specific resources. If you're, Bilal, if you're asking for specifically Irish emergency medicine training interviews, go to IAEM's website. There's plenty there. What are the current issues? There is an emergency medicine program EMP document, which is a fairly long document. I've never read it fully. I'm not sure if anyone else has read it fully, but there are big highlights on this, that how emergency medicine and how acute medicine program and how they marry each other. And, so look at those resources. And again, if you are asking for a specific textbook to read, there are no textbooks. Oxford Handbook of Emergency Medicine is generally more than enough to give you the clinical ethos that you would need for that interview. But again, your interview is not clinical. They'll be talk us through your CV, challenges in emergency medicine. There will be a conflict resolution scenario. There will be a clinical scenario. There will be one station about your research. What have you done about your research? And you know, can you please tell us about GP's current issues or topics? So I'm not a GP, and Adil or Waqar, we are not GPs, but I've just recently spoken to a GP. Zainab, there's a video on our group in which Brian King, who's an experienced GP, has very nicely detailed what are GP challenges, how GP scheme is changing. Just to give you a few, about 25% of GPs are over 65 and are going to retire in the next 3 years, and they haven't recruited. GP contract always comes in the news. You should know about that. Vaccination, current COVID vaccination, and the role that GPs have played, you should know about that. How GPs have managed their services open in COVID crisis, you should know about that. GPs don't have HSE contracts, financial side of that, you should know about that. And then you should not only know about GPs, so a lot of people, when going to the GP surgery, they think that GP is one sole practice and you have your room and you have your patients. No, it is not. GP is essentially your public health. You've got your public health nurse, you've got your public health care center, you've got your community physio, community health, mental health would come again. These are common things in GP scenario, but if you go through the video that Brian has done, Zainab, I might share it again on the group, that would tell you that he has detailed it very nicely. And whichever scheme you are going for, go to that college's website. The most important up-to-date news about what is RCPI doing, what is ICGP doing, what is IAEM doing, what is RCSI doing. You should know that inside out. COVID is going to come up in all your interviews across the board, and you'll have to take your own approach, whether it's GP, whether it's surgery. I will share it, Essen and Zainab, on the WhatsApp group. I'm not sure if you're on IPPA's WhatsApp group. I will share it again. It's on IPPA's website as well. If someone is not on it, you can. I'll give you the details at the end. Anything else, Adil or Waqar? Adil, anything else that comes to your mind?
Other thing I think we mentioned before as well, if you get asked why do you want to do this specialty, have a personal answer. Don't have a generic answer. If someone asks why you want to do surgery and they tell me, oh, they like being in theater, doesn't really mean much. It just means that you like being in theater and operating with your hands. That's everyone's very common answer. But if you tell them, look, I have experience as an intern, I worked in a busy tertiary center. I was able to get involved in theater. I liked the team dynamics. I liked how we were able to actively manage a patient. Once they improved, they went home. I liked how we dealt with issues, and that's why I like surgery. It seems more of a personal answer. It brings in your little bit of clinical experience that you have had, and it highlights those things better. So I think having a personalized answer for those things, think about your answers. Don't make them a generic, off-the-book answer. Yes, you can use that answer as a base, by all means. Use it in practice, but then personalize it. If you highlighted the points in the book, it says you need to be good with your hands. That's why you want to be a surgeon. Personalize it. Say that you have been in theater, or what you've done in theater and what aspects you liked of it, and say those things. Or if you like the aspect that you discharge patients quickly, say that, but have some personalized experience to it.
Every question, every answer should be coupled to your personal experience. If it is research, your personal research. And again, if you don't have any research, I had very little research when I did my SPR interview. And the question I was asked, so well, and the person across the table, he was really straightforward. He said, well, Mustafa, you're coming across as very nice, but when I look at your research, it is really appalling, isn't it? And I was quite taken aback, when you're going for your SPR interview and you've done reasonably well in most of your interview sessions, and then this person says your research base in your CV is really appalling. But how can we? I said, yes, I understand. I know that my research base is really appalling, but let me tell you why it is really appalling. Because for the last 3 years, I've been working hard on my CV. I've been doing this course, becoming clinically proficient, becoming instructor in this, instructor in that, instructor in that. I've done this ultrasound course. I've done that, all related to my specialty. And that has made me a much better clinician. And that is why I'm sitting in front of you today in this interview. And over the course of next 3 years or 4 years or 5 years, I intend to do an audit. And this is my idea of having an audit. I would like to audit this. I would like to audit this. And if given a chance, I would like to do a study on this, because this is going to help early discharges in emergency medicine. So come up with, sometimes the person who is sitting on across the table has had a long day. You're not the first candidate going in front of them. They've probably interviewed 36, 37, 49. They're going into a caffeine deficit. So don't be taken aback. Like this was literally what the person said to me, that your research side is really appalling, but you need to give it a positive spin. But again, by adding on to your personal experiences to it. Anything else? Any other questions that we have? We have about 9 minutes, and then we will be wrapping up. If you have any other questions here, we would be very happy to take. Otherwise, General Trip says, dress nicely. That was what Makar Saab mentioned to me before my interview. Dress in, don't be looking very colorful. Dress in, black suit, white shirt, black tie. The way you go to court, that is look professional. Okay. Where do you see yourself in next 5 years? Yeah. So have, Bakar, any?
I think that's a very common question. I always ask that. And it's just like, when we are trying to take somebody into a specialty, or we are trying to give a job, especially training post, you're looking at their kind of, ambitions, or their kind of imagination. And some of the candidates, you have to be very honest. You have to be very confident. There's a difference. I have a problem when people are more confident there than they are competent. But in 5 years' time, I want to be in a training course because I want to become a consultant. So you always have to have some kind of a vision. In 5 years' time, I don't know. I don't even know what the exams are going to be. I don't know what's the training post going to be. So 5 years' time, you should have a definite answer, have big ambitions. It's nothing wrong. It's good to dream, to have good ideas, big ideas, but then you need to know the way how to achieve those. So that is a common question which comes in all the interviews. And I'm just looking at the person, what kind of a vision this person have about their career progression. And it's never static. If you're even become a consultant, what are you going to do in the next 5 years' time? How do you see your career until up to your retirement? So this is kind of a continuous progression of our career that we need to be focused on. The other things which I was going to say, about the interviews, the last interviews which I took, very important, where are you sitting? The back of the wall. It's not the sun reflecting on your eyes, the way you're dressed, the way you're looking at the screen. So I think these are very important kind of things, which just shows what kind of a person. I don't know anything about you. I only have a glimpse of you for those 10 minutes. And I have to know this person looks smart. This person looks clever. This person knows what he or she wants and knows how to achieve them and are going to be a good addition to the specialty. That's what I'm looking for. And only in those 10 minutes, you have to make that impression on the person across who is interviewing. So that's important.
Anyone has any other questions coming up? We are coming to closing time. Michaela, I will, IPPA will tweet the video on their Twitter account. If you follow us on our Twitter, we will tweet the video, the link to the video. It is on YouTube, but I will tweet that video so everyone can have access to that. Just a few general tips again. Positive attitude. A lot of people will tell you that you are probably not going to get that interview. You're not going to get the job, or you're for whatever reason, go with an attitude that you are the best person there. And that is what Waqar Saab told me 7 years ago, and that worked for me. Okay, you are there to get the job. You are in, so your CV gets you the interview, and your performance in the interview gets you the job. Okay, so you're on your CV, you have proved that you are the best candidate for this interview. Okay, and in that interview, go with an attitude that you are there to take that seat, that this is your place and you are here for that interview. Don't be trying to hide away or be very gentle. Speak up. Obviously, don't sound offensive, but speak up, speak clearly, give decent gaps. If you struggle with your public speaking, practice in front of a mirror how you're going to answer the question. Record yourself. Okay, record yourself, and and then see how does it sound. Can the other person understand you? A lot of time, our accents are difficult for them to understand. Their accents are difficult for us to understand. If you're finding hard to understand something, ask. Sorry, I cannot understand that question. Can you please tell that again? There's no harm in asking that if you're finding it hard to interpret what the other person is asking. Adil, do you want to add on anything?
I agree with you. So I think practicing is the big thing. For any interview, practice as much as you can. Practice in front of a mirror. Record yourself. It's very uncomfortable to see yourself back in recording, but it teaches you where you pause, where you don't pause, where you should be looking, what you should be doing. I think that is important as well. In the end of some interviews, they generally ask, do you have any questions for us? In all honesty, if you've prepared well for an interview, you know about the post, you very rarely have a question to ask. And you can say that. You can say, look, I've done my research. I've asked my seniors. I know about this post. I am looking forward to joining this post and being an asset to this team. I don't have any questions as such. I've done my research. And I think that's an appropriate answer. But if you've prepared for an interview well enough, you already know most of these things. You should already know what the job entails, what the scheme entails, what exams you have to do, how you're going to progress, and what competencies you need to meet for progression. So it's most of the interview is in your preparation and in your practice. So you have to practice as much as you can for an interview. Practice with your friends, family, doctors, even if they're non-doctors, just get them to ask you questions. And the more you practice, the better at your answers you'll get.
And ask your colleagues, your seniors, your SPRs, those who are on the training scheme, speak to them, talk to them. Sometimes people are really shy in asking. There is no harm in asking, and they'll give you the best advice, the best tips, because they've recently been through that interview cycle. So they know what was asked previously, and certainly the way they answered the questions got them successful, and they're there as SPRs or BST trainees or GP trainees, whatever you're looking for. Ask them. What is the answer? How did you approach it? And that would be the best scenario. If my research is in the initial stage, should I mention it in my CV? Yes, please do mention it. But you should also know everything about your research and how you're going to take it forward for you. Top tips for preparation and a summary. We have got 2 minutes. Waqar, Adil, I'll leave the ground open to Waqar. First you and Adil, then you.
Okay. I think a very important thing is know about the job that you're going into. Think about what are the requirements of the job and do you fit those? And think about what are they looking for in myself as a candidate. These interviews are very predictable in different specialties at different levels. So talk to people and they will pretty much tell you what is the requirement of the interview, what are the questions, what are the stations, and how to answer them. Have a lot of mock interviews with your seniors, as Dr. Mustafa said, and that will give you confidence and that will give you a kind of a practice. And if there's any weaknesses the way you're expressing or saying things, it will get corrected before the interview. You are the best person. Don't say, I think I'm the best person. Always say, I am the best person for the interview. I work hard. Don't say, I think. That's what I was told by my colleagues. Don't say, you think you are. No, I am the best person. Yes, I have these strengths. Yes, these are the things I need to improve upon. But I love this job. I'm the best person for the job and you should trust me. Yeah, thank you very much, Dr. Adil.
I agree. The more you practice, the better you'll get at the interviews. It's all about practicing. Practice the scenarios in front of a mirror, practice your clinical scenarios, practice your questions of how to answer a CV, see how you go. Every time you answer the question, you'll improve on it, and just keep improving and you will get better. Like Mustafa and Dr. Waqar said, absolutely 100% speak to your seniors, get their input, get their advice, drag them to a side, buy them a cup of coffee if you need to, and get them to practice an interview with you. The more you practice, the better you'll get at it.
Yes, absolutely. Just to summarize everything that they've all said, and we have all said is practice, practice, practice. You're there for the job. Dress nicely, very important. Work on your speaking, the way you work. Give your gaps. Look at yourself in the mirror. Record yourself and play it back to you. And that is going to give you an idea that how can you understand yourself when you're answering a question. And then someone said that, when we are speaking, sometimes we use a lot of Irishisms or, for example, saying words like grand, the little words that you would say in your regular conversation. But when you're sitting in front of an interview, try to cut them off as much as you can. And just go with a positive attitude. You're there for the job. You're there to take the job. As I said, know your CV. Prepare these. These are the questions that will be asked irrespective of what specialty you are going for. Channel them to your specialty. Channel them, practice them in front of a mirror, practice them with your SPR, with your seniors. And that is all that I have to say. Thank you, everyone. I think we will wrap up. It's exactly 1 hour since we started. I would especially thank Dr. Waqar Shah for giving us this, his aspect from sitting on the other side of the desk and the way he sees things and what his aspect is. Adil, thank you very much. Adil has had a couple of very busy calls. Me and Adil work in the same hospital. I know that he's been running a very, very busy shop. So thank you very much for taking time out for this. If there are any other questions, people who are on the WhatsApp group, send them on to us on the WhatsApp group. And again, we'll try and answer those for you. Those who are not, send me your number or follow us on Twitter or message us on Twitter, and I will get back to you. Thank you, everyone, and all the best for your upcoming interviews. If there's anything else that we can do to help you from an IPPA perspective, we'd be more than happy to help. Thank you.
Thank you,
Adil,
and best
and
of
thank
luck.
you, Waqar, again.
Thanks very much.